now. And we are incredibly gratified by the response we've had to this so far. We've already had about 225 people or so sign up to be a part of this network. And we see tremendous room for growth in that number because we seem to have just a couple of people from each of the AOT programs that we're aware of, or groups developing AOT, a couple of people from each represented so far. And so many of you have many more colleagues who are working on AOT with you locally, who we really see as untapped potential to grow this thing. So we really urge you to take that initial email that you got from us inviting you to join this network and asking you to complete the survey, forward that to all the people working in your program and encourage them to join so that we can really build this network up. Because I think the more people who are taking part in it, the more diverse set of experiences and roles we have represented, the more everyone's going to get out of it. I also want to just briefly kind of introduce what I call our AOT implementation dream team, which I'm super excited about, that we have really put together at TAC. And that includes me. I'm as policy director. I'm someone who comes to AOT from a legal background. I was involved in drafting the AOT law in New York and many other states, and really kind of focus on the role of the courts and interpreting the statutes and making the laws work in the programs that we help build. We also have Betsy Johnson, who is an amazing longtime mental health advocate and a family member from Ohio, who's just incredibly knowledgeable on how to build the support locally to get an AOT program off the ground. She's done it in so many places and also knows so much about the nuts and bolts of operating a program day to day. And really, Betsy deserves a lot of the credit for the emergence of her state, Ohio, as a state with a really high rate of AOT implementation. We also have Amy Lukes, who has been with us now about a year and a half, who is the one person in our organization who really has that clinical background that's so important to sharing knowledge about AOT. Amy's a licensed clinical social worker who has actually worked for quite a while in an AOT program in Ohio and Summit County, and brings that knowledge of the clinical many aspects of AOT to our team. So the three of us together really think we're in a great position to help folks in all kinds of ways to get AOT programs going and make them effective. So this gathering here today is an example of one of the things we're hoping to do with this learning network. As I said, just kind of bring people together for conversations. Unlike a webinar where we're trying to impart information from us to you, or maybe from a guest speaker that we have, here we are not so much imparting information, but just trying to facilitate a conversation and hopefully some information sharing that will be useful among all you guys. And for an initial topic, we thought there would be nothing more timely to possibly discuss than this question of how AOT programs are coping with the COVID-19 pandemic. Obviously, this just current period of global crisis is impacting all of us in fairly universal ways, but it's also having very specific impacts on specialized populations, such as people with SMI who are participating in AOT programs. And we'd really like to drill down on that a bit and get a sense of how you guys are all making the best of a really, really challenging set of circumstances. And we don't want to be Pollyanna-ish about it. We know that it's just not possible to make AOT run as smoothly and serve participants as effectively under a COVID shutdown as it is in normal times. So what we're really hoping to discuss today is not, how are you eliminating all these impacts, but rather how are you mitigating them and making the best of this crummy situation.
Yeah, not surprising considering we're at home alone. I noticed some of you are at home, some of you are in your offices. Tired? Boy, I was a provider, over 10 years ago, and through this whole thing, I cannot even manage. I cannot even imagine how you all are managing.
So we're going to kind of try and divide this conversation into three buckets. It seems to us there are kind of three major topics that make up this large question of how folks are dealing with COVID. And the first one is going to be that we would like to have a discussion about how programs are dealing with maintaining a participant flow and dealing with the court process in a situation where courts are largely shut down and not holding the most essential kinds of court hearings in person. The second thing we'd like to get into is how COVID is impacting the quality of treatment that people are receiving while they're under AOT and what things are being done to mitigate the challenges of providing good services to people right now. And third and finally, we'd like to have a discussion of how programs are working to keep their staff and their participants safe from contracting COVID-19 virus. And of course, if there are other things that don't fall into any of those topics, people can feel free to raise them in the chat box. But I think that's going to kind of go over the major things that people are grappling with. So let's start by getting into this question of maintaining a participant flow and maintaining a fairly smooth court process. And one of the people we wanted to, I'm going to kind of call on a few people based on some answers we got to the email we sent out and some folks who sent in responses. Just seemed to facilitate the conversation. It might make sense to sort of start with some of those people. And Nicole Bermejio, who works with Judge Kazin in San Antonio. Are you on the line, Nicole?
Yes, I'm here.
Oh, hi, how are you?
I'm good. How are you?
Great, thanks. So Nicole, can you speak to what the initial impact was of the COVID shutdown on your court process and how you all have adapted the legal process to that challenge?
Well, luckily, my judge is actually on the line. We work with Judge Kazin here in Bexar County. So the way that it kind of first impacted us was, of course, he wanted to make sure the safety of all of, his staff and our consumers that we work with. So we ended up kind of halting our staffings pretty quickly to ensure the safety of everyone until we were able to get everything figured out. But once that was the case, he worked really closely with our court liaison and myself to, ensure that we could follow up with those staffings. But, we still had our case managers out in the field where appropriate. I mean, I'm sure a lot of you guys were also dealing with the lack of PPE and, we wanted to make sure everyone was safe. So we were definitely scrambling for a while, but I will say we're a little over a month and a half in, and we're finally kind of getting our little deer legs back up, so.
Yeah. So you talked about staffings. Is that your practice to hold a staffing with the judge and the treatment team like the day before or shortly before you bring people in for their kind of check-ins with the judge? Is that what you're referring to?
So we do that. That's kind of like our weekly checkup. So that's with the court team, the attorneys that are part of our program. We do that once a week where the consumers or the clients come in and meet face to face with the court team.
Gotcha.
Every week.
Staffings, you're actually talking about not before the hearing, but you're talking about actually bringing the clients in to talk to Judge Kazin about how things are going.
The model we use in Bexar County, Brian, as you know, is once a week they visit with the judge, but we do our staffings all at once. So the liaison and the provider will come into the room and we'll discuss what's going on with the patient for a little while, and then we bring the patient in. We just do it sequentially. Now we're doing that the judge part of it by Zoom and remotely. The field workers are still going out when they can, but we escalate the point of contact. They come into the room, we Zoom them, we have our discussion. If they need further attention, they actually need to be admonished by the court, then we'll actually bring them to court, but everybody wears PPE and gloves and the like.
So you're doing a combination then of live hearings where absolutely necessary and remote Zoom hearings where that works. Is that right?
That's correct. Nicole can speak to how we do the Zoom hearings, but almost all of them are now Zoom. And you know what? It really, I mean, the response we're getting from the patients I thought would be horrible, but it works.
Huh. Would you say it's working to the point where you'd even consider doing more of that when things, get back to normal and we're not required to do things this way? Or do you think it will be better to do all hearings more?
I think for us, since we're set up to do the live meetings with judges, we'll probably continue it. But what it's taught me is that those jurisdictions who have complained about, well, our judges don't have time to be doing that. Wow, this makes it so much easier. I mean, Nicole, would you guys agree on that?
Yeah, so one of the ways that, and do you want to talk? Okay. Sorry, I'm here with the court liaison as well. But so what we've essentially been doing is trying to really determine who is appropriate for this kind of the Zoom setting. We found in this particular instance that he's talking about, we had a client brought in, he wasn't as receptive to the Zoom appointment. So we ended up, corresponding with the judge. We set up that admonishment time, and where appropriate, we were all wearing appropriate PPE, and that kind of ended up being more sufficient for this specific person. But we have had consumers where they're responding just as well. And also, I don't know if anyone else is experiencing this, but the ones that are coming in new, this is all they've known. So as long as we act like we know what we're doing, they're just kind of flowing with us, and it's been going well.
Normal to them, yeah. No,
exactly.
So,
we just fake it till you make it.
yeah. So will there be like one person with the client in their home who brings in like a tablet that they're using to communicate with, or?
Well, we explored that as an idea. We actually did that today for an admonishment for a consumer. We weren't actually sure whether they'd be safe for transport. So they actually did that today, and it ended up working well. We were able to get virtual eyes on the client, which actually ended up resulting in a detention. But for the most part, when we have our staffing, just to kind of have more of a controlled environment, we're actually assigned, like the case manager who's assigned to that specific client, they'll come in to our clinic. So that way we have one computer, just because a lot of technical difficulties we've been trying to avoid as much as we can.
Sure,
so we have one computer set up, and the clients and case manager come in, they Zoom for their specific period of time with the court team, and then they'll leave.
Interesting. And one more question before I kind of open up the floor to others' experience. I'm wondering if it's only the staffings that are being held that way, or if you have done initial hearings where people are placed initially under the AOT court order, sometimes even where there's a need for psychiatric testimony. Have you all done those remotely as well?
Yeah, we switched pretty quickly because we were already on that cutting edge trying to make it happen before COVID.
Yeah.
So all of our patients and consumers now testify remotely. I don't have them coming down to the courthouse anymore. And in fact, we've even tried all the members at remote location, the DA in their spot, public defender in their spot, the patient in their spot, the Center for Healthcare Services in their spot, and me in my chambers. It turns out that at least as far as the public defenders and the liaison officer and the district attorney, they like to meet in a secure area to do it on one big screen. But the patients, the doctors, the judge, we're all remote. They don't come in. They do the initial intake, the discussion. I think Nicole hit the nail on the head. As far as they're concerned, that's how we've always done it. So they don't see a difference. And it actually works. It does.
Yeah, amazing. So let's open the floor up. I wonder if there's anybody else who'd like to talk about their own experience of holding hearings remotely, whether that's going as smoothly everywhere as it seems to be in Bexar County.
So Nick, you want to share, please?
Yes, so in Butler County, we are doing live hearings. We are doing Zoom hearings for initial hearings and review hearings. So Cassandra Kesey, our prosecutor, is also on this call. So we do initial hearings at several hospitals with the respondent, the doctor at the hospital in a treatment room. And then everyone else is at their homes or offices doing this by Zoom for the initial hearings and forced med hearings. And then we are trying to do as many ongoing, what we call review hearings, using Zoom. And some people we've identified as not being suitable for a Zoom meeting, and we'll continue it to a later date when we can do a live hearing. We do Zoom where we've had case managers go to clients' houses, put the client in the back seat and the case manager in the front seat, both wearing masks, and doing Zoom that way. So we just kind of identified who can handle Zoom, who can't, who has the technology for it, who doesn't. As many of them as we can do by Zoom, we tried to, so we don't get too backlogged in the future. But we do understand that some people really need a live hearing, and we're going to try to wait till June in hopes that we can do that.
Yeah, things are open enough in June that that's even going to be possible. It's a great unknown for everybody. Is there anyone who's had difficulty making these remote hearings work, or are there any places where hearings have just been halted entirely because they can't, for whatever reason, logistically make the technology happen?
I'm trying to unmute M. Holman.
I'm unmuted now.
Okay, great. Can you share what's going on in Michigan, please?
We are using Zoom for pretty much all of our hearings. I'm not aware that we're having any clients come to court currently. Most of our hearings are from hospitals.
Mhm.
And Cassandra Kesey asks, is anybody concerned about privacy issues?
Do we mean specifically related to the fact
Zoom.
Zoom could be infiltrated by somebody who has the meeting number? Yeah, I mean, that's a good question.
Brian, the truth of the matter, at least in Bexar County, in Texas, and I think for most jurisdictions, that part of the hearing where you commit an individual is required unless, at least in Texas, unless the patient asks to be a public forum. We don't commit people in secrecy. Almost every jurisdiction requires that these hearings be open to the public nonetheless. So even if somebody did access them, most jurisdictions require the commitment part of it to be public. We paid for the license, the big, huge, expensive one that theoretically should not be able to be hacked, but we have not had any issues. I'm sure, as in anything, any of our computer systems can be hacked. But I think, we've done our diligence. We're doing as best we can. If somebody does hack in, that's just, I think, a danger that happens in every process we do now. But that's how we handle it.
Yeah, it's interesting. There are a number of states that actually say in their law that a civil commitment proceeding shall be a confidential proceeding. So by
Right. Yeah, ours is different.
it is closed. I know.
Stephanie.
It's not just. We just want to throw in. It's not just a matter of like a hacker getting in. Zoom meetings are extremely porous because anybody who just happens to have the link, because it's been shared with them, can just pop into a Zoom meeting. So I do think it's important that who's ever kind of commandeering the meeting is very aware of who's actually in the room.
Right.
Stephanie.
Yeah, I mean, as a practical matter, the judge, we have we're the central point on who's in and who's out in our meetings. So yeah. I see your point.
Yeah. Was there someone else, Amy, who you wanted to recognize?
Stephanie.
Yeah.
Yes.
You mentioned.
Oh, Zoom also has, we can set up meetings with passwords. So I'm sure it could be hacked, but it feels a little bit more confidential.
Yeah. No, so another kind of related question to this issue of how AOT programs are just managing their everyday flow of cases and seeing people and dealing with people is, we are hearing from a number of programs that new referrals have really been stymied by the current circumstances. I think Lisa Schatz Vance in Albuquerque in particular let us know. Lisa, if you could just speak a little about the fact that you guys are seeing a decline in referrals, and you can just tell us what you attribute that to, and I'd be wondering if other people have had that experience.
Hi. Our designated agency that handles the referrals is a community behavioral health provider. And so they reported to us that they were seeing a significant decrease in the referrals, but unfortunately, we really haven't been able to determine what in fact can be contributing to this, other than understandably under these circumstances that we're all facing right now, that perhaps family members are stressed with other issues such that they're not looking to make referrals. Really, it's an unknown. So we're probably
yeah, I'm sorry. Do most of your referrals actually come from family members taking the initiative to say, I want my loved one in this program?
No, I would say we have a mix between, so let me just back up for a moment. So the program here in Albuquerque, New Mexico, our primary point of entry is a community entry point. It's not from the hospitals. So we're working with a different path to AOT. And in doing that, we have our own share of challenges. But that being said, what we see primarily are referrals from crisis intervention folks, our mobile crisis teams, and HopeWorks itself handles a wealth of behavioral health services. So sometimes it's in essence an internal referral, but we do see a handful of family members who are also making referrals.
Yeah, yeah. So most of your clients then are not coming into the program as a transition from an inpatient stay, unlike other programs. Is that right?
That is correct.
Yeah. Interesting.
So
ongoing work in progress.
Yeah.
Yeah.
I'd like to go back and revisit the whole Zoom thing.
Yeah.
Jean Gore has a message on chat. Jean, can you unmute yourself? Because I'm having trouble locating you on the screen here.
I just unmuted myself.
Perfect.
So we had a hearing. My son has been in Maine's version of AOT, which is called the PTP program, since 2013. And every year it needs to get renewed. So we had to have a hearing in April via Zoom. And the pro of doing it that way was that my son actually preferred it to what usually happens is we have to drive 3 hours north of us to the hospital, Dorothea Dix in Bangor, for the hearing. And he is really, I mean, he's a homebody to begin with. He doesn't like going far from home, and he's very intimidated by these hearings, and he has no awareness of his illness and hasn't for a decade and a half. And so he feels like it's really, in his words, a witch trial. It's a very upsetting thing. And I'm his guardian, so I have to testify. I also cross-examine people occasionally and call my own witnesses because that's my right in the state of Maine anyways. One thing that has nothing to do with the COVID virus, and I'm not sure how anyone in other states handle this, but I thought I would mention it, especially for people writing AOT programs or trying to promote them in their state. One of the reasons you may not hear from a lot of family members is because family members don't know you exist, a lot of them. They don't know, at least in the state of Maine. I run into this all the time because I've been an advocate for many, many years. I have a lot of people who call me in a crisis, family members asking me for help, trying to send them in the right direction. And I often will mention the PTP program and explain to them that they have a right to apply for it and explain the process to them. And I find that they aren't aware at all, A, that the program exists, and B, that they have a right as next of kin to attend the hearing, to call witnesses, to testify. And even the judges, and as I said, I've been doing this since 2013 when we finally got the PTP program passed in Maine. Every single time I get ready for a hearing, I have to make a million phone calls trying to just get on the list of people allowed to testify. They send me to the courthouse, then they send me to the Attorney General's office, then they send me to the hospital, and finally I get on there to testify. And at the very beginning of the trial, my son's attorney always attempts to get me kicked off the list of people who can speak because he knows that I'm going to be speaking in favor of the PTP program, at which point we have to read the statute to the judge so the judge will understand that I'm allowed to be there. So I think it's important to find ways to make family members aware that these AOT programs exist.
Yeah,
And
no, I totally agree.
and it's also just as important to educate judges in the states where you have these programs as to what the statutes are and who's allowed to testify, etc.
Yeah, so Gene, you're raising incredibly important points. I want to keep the discussion today really focused on how programs are responding to COVID specifically. I think the things you are asking about and want to talk about are going to be a great topic for a future session. We're going to do a lot of these sessions, and I don't in any way want to be dismissive of the importance of talking about the stuff you're raising. And if anybody has a particular response to Jean and wants to forward it through us, we'll get it to her. But I'm particularly curious about what your impression was of how the hearing went when you did it with your son remotely. You talked about what the upside was, the fact that you didn't have to travel as far to get to the hospital. What from your perspective was the downside of doing the hearing remotely?
There really wasn't a downside.
Okay.
I mean, they're always uncomfortable anyways.
Yep.
There really wasn't a downside. I preferred it as well because they used to have us call in, and when you called in, you didn't get to hear what everyone else was saying. You were only allowed to be on the line as long enough to give your testimony, and then you hung up. So
Gotcha.
I thought it was great.
Well, that's good to hear. And, as we've said, maybe for programs that are dealing with a large geographic area that aren't in a major metropolitan area, this is something that's good that's going to come out of this, is a realization that, there is this opportunity to do AOT hearings remotely and check-ins remotely. On the question of referrals being down, I wonder if any of the programs that are more reliant on hospitals for their inflow of participants have also noticed a decline in referrals, because I'm certainly hearing from many areas that it's become harder than ever to find an inpatient bed for a person in psychiatric crisis. And so I am curious to know if programs that are reliant on people who are transitioning from that inpatient stay into kind of the soft landing of an AOT program, if the crisis in hospitals that has made it so much harder to get people inpatient care has led to a decline in the numbers that you're seeing in your AOT programs. Does anyone have something to say on that?
Hey, Brian, it's Jenny from Tarrant.
Hey.
We've actually had the opposite effect. I did kind of a survey of all of our local inpatient hospitals a couple weeks ago, and with the exception of John Peter Smith, our county hospital, most of them were running at less than 65% capacity. One of our geriatric units actually even shut down because they just, 2 out of 22 of their beds were full. So we haven't seen it horribly bad in Tarrant County, but what we have noticed is the treatment teams at JPS aren't, even though everything also, like Judge Kazin said, everything up here in Tarrant is the same Zoom. The doctors and the patients are at the hospital, the attorney and the DA, and they're ad litem. The attorney and the DA are downtown at the courthouse. The hospital seems to be doing more continuances lately and not taking people to court. The folks we have had referred into AOT for various reasons just aren't good matches to the program.
Yep.
More of a substance abuse issue,
Right.
more of a homelessness issue. So I can't really speak to why across the country it seems like beds have been filled to capacity versus, we're a pretty big geographic area and we just aren't seeing the numbers.
Yeah, that's interesting. All right, unless anyone else wants to weigh in on that subject, I think it's a good point to transition to how COVID is impacting the quality of treatment that folks are getting through AOT. And there's a few people we wanted to turn to here. Jenny, you're on the list of folks I wanted to hit on this topic, so let's just continue with you. You told us in the email that you guys are taking kind of a team approach to how you are continuing to work with clients and under the circumstances. Can you talk a little about that and talk about how
Sure.
that's different than the way things were before?
So a lot of our stuff, obviously, as many people have, has changed to telehealth. So right now, both our conference calls with the judges have transitioned to Zoom. With us in and of itself, we're using GoToMeetings. So right now, my staff, for the most part, are still going out to physically see clients for various reasons. They don't have a computer, they don't have a smartphone, they're unable to connect to see their prescriber. So they're still physically going out, seeing people with their phone or their laptop to be able to connect them in. Initially, we tried to do everything telehealth, and unfortunately, with our population, a lot of them aren't as thrilled with being on the phone or on telehealth. They want to see their caseworker, their peer face-to-face. A lot of hard times getting psychosocial rehab done over telehealth. So we have been in a position where we've kind of been transitioning back out, obviously with PPE in place. Our nurse, we're still trying to limit clients actually coming into the clinics. So for folks who are on LAIs, the nurse is actually going out in the community and doing the injections at their house.
Wow.
So it's kind of been an interesting mixture. We're trying to engage as much as we can with telehealth, and when that just doesn't work, we are doing actual face-to-face home visits.
Yeah. Let's talk to Mari Tellez in Las Cruces. Are you on the line, Mari?
Yes, I'm here.
Hi, how are you?
Good. How are you?
Good, thanks. So is that what Jenny's describing? Is that, would you say that's consistent with what's been happening in Las Cruces? I know you also are, not seeing people in person as much quite as before. So.
Yes. So we are doing as much telehealth as we possibly can, but we do have clients that still receive daily deliveries of medication. And we do have clients that are case managers that actually go out on a regular basis to face-to-face to see the clients that need a little bit more assistance. Before they enter the home or do anything with our clients, of course, they do the screening for COVID, make sure everybody is safe. But we found that that is working for us, and our clients have received a lot of education over the past few weeks about staying safe and staying home. And I think it's really helping them to be there and to be more regular with their services. So that's been an upside for us. Of course, we do have clients that we're not able to find or to locate because they're homeless or anything like that. So that has, that's always an obstacle, and that is still an obstacle here in Doña Ana County.
Yeah, I know you guys have a lot of people living like in the tent city that you have there, right? So
Yes.
they're basically homeless, but just like maybe half a rung from street homelessness. How does telehealth or video conferencing work with people in that situation? I can't imagine it can.
So what we are doing is our case managers are going out to the houses of our clients, and they're taking their laptops with them. And they set up the laptop so that the client can see their therapist. And their therapist, is working out of their home right now. And so really the only people that are having face-to-face contact with our clients are case managers. And everything else is, even our court, the case manager will go out to their house and set up their laptops. We have, our obstacles are if our clients don't have phones or internet access. And so that's how we have found that we can overcome that, is the case managers will go out and do it for them.
Yeah, which is obviously not ideal, but you do what you got to do.
Yeah.
So we have Stephanie Sanders. I think we've spoken a little bit already. She manages the ACT teams for Summit County, Akron, Ohio. Stephanie, would you say that the services that you're providing clients have been reduced during the shutdown? What have been the impacts there?
What we've done is we've reduced the amount of staff that are going into the community to work with the clients on the ACT teams. We have approximately 4 case managers per team. We're still going to the community for med monitoring. We're doing our psychiatry appointments via Zoom, primary care appointments via Zoom. Our staff have the tablets to go out and be able to help the clients get to those appointments, you know, on the tablet. I think it's definitely, though, reduced the quality of our treatment. I feel like we're just kind of triaging in a sense of just, you know, bare bone minimum as far as med delivery. We're not really monitoring as many meds as we would like to. Maybe some of folks that really need us, we are. But it's very reduced and then reduced and then reduced again. And it's still a lot of people. We've been fortunate at our agency that we're actually paying, we're calling them our hazard workers, so we pay folks a little bit more money that are willing to go out into the community to be in close contact with our consumers. So I think we're, you know, it's definitely affected the quality. We're not doing counseling, we're not doing group counseling. We're not really even spending a whole lot of time talking about recovery from alcohol and drugs or just mental health in general. It's really just kind of triaging. As far as our AOD, Summit County, we have not had a court hearing since, I believe the last one we had was March 4th. And I get the copies of the paperwork of folks that have been civilly committed to AOT, and it doesn't look like there's really a slowdown in the number of those. We're actually planning on going back to court next Wednesday, the 13th, and we've kind of divvied it out that we only have like 10 people in the courtroom at a time, kind of spread out when people arrive, reduce the number of case managers there.
Yeah, so Summit's continuing to do its hearings live, it sounds like, huh?
Well, we haven't had one in 6 weeks.
But
So we're going to go back. We're just going to go back to live. The judge had, Judge Stormer had suggested perhaps we could do some Zoom if somebody was really struggling and we thought, you know, would benefit that. But that's kind of what we've been doing. It's very different when we go to court this coming week because we have a new day court program where people present to the judge. It just depends, you know, how often. But this next week, it'll be all brand new people to the process. And there's also been a little delay in our continued commitment hearings too. So unfortunately, some folks have just kind of been in limbo until we get those back on the books, which is at the end of May.
Right. Well, we really appreciate, you know, the frank assessment of how things are going. I'm really curious whether the decline in the quality of treatment that people are getting that you've talked about, whether you think that's translated into like an uptick in people going into psychiatric crisis. Are you actually seeing that result in how well people are doing?
It really kind of ebbs and flows. We definitely have had some hospitalizations, but that's kind of par for the course. We work with a dual diagnosed population too on the ACT teams. So I haven't seen a big change, but we're definitely, to be very honest, we're not really, we just kind of put out fires, make sure people have their medicine and have food. I mean, it's really that simple. Yeah,
hear you. Does anyone have anything they want to contribute to this part of the discussion? Amy, any comments coming in from people?
This is Jean Gore. I would like to comment that one thing that's happened, at least to my family member directly, is that they announced this week that the person who provides his medication management they're closing their doors. And so now, in order to get his, he has an antipsychotic medication that injection every 2 weeks. In order to get that, he will have to drive almost an hour each way to the next closest place to have a provider. And his psychiatric nurse will also be almost an hour away. And his response to that was, I'm not driving that far. And what's going to happen is I'll just go back to the hospital so that I can prove to them that I'm not ill. That's where we're at.
So one thing I'm wondering about among those of you on the call who are dealing directly with patients is whether you are finding that the COVID crisis is feeding into the psychosis of your clients in any way, whether certain participants are actually doing poorly in terms of maybe delusions they're having, or the fact that we're on kind of shut down and there's all kinds of maybe reasons for paranoia that didn't exist before is kind of feeding into some of the struggles that people have. I wonder if anyone can share anything about issues like that going on.
My name is Jennifer Hallcroft from Tarrant County. I am the alpha for the AOT program here. I will have to say that one of the things that I have discussed with Jenny and Sarah and some of our staff is my surprise at the lack of increased anxiety, irritability, returns to the hospital, etc., from our clients. And so the staff has been talking to our individuals and finding that this is not quite as distressing to them as it is to us. Number one, because they typically stay in their house and stay to themselves and don't seek outside activities. The other thing is due to the lack of access to technology, whether it be a phone or computer, they are not like following the news or understanding the impact that this virus is having around the world. So I think those are two significant statements from our folks, and to explain why there hasn't just been, at least in Tarrant County, an overwhelming return of clients to the hospital.
Yeah, that makes a lot of sense. That's really interesting. Anybody else have a reaction to that? Any more comments in the hopper, Amy?
Jean mentions that her son believes that he is immune, and so he doesn't social distance, wash his hands enough. And
yeah, that's interesting. I mean, that kind of gets us into our third topic. It's probably a good transition. The third thing we wanted to address in our time today is how programs are managing to keep their participants as well as their staff safe from transmitting or contracting the virus. There's been a little talk about PPE. I'm first wondering whether there is universal availability of PPE, if any programs have experienced challenges with getting the PPE that their staff who are interacting directly with clients need. Does that, anyone want to speak to that?
This is Nicole in San Antonio again. I just wanted to comment on, so the LMHA that we work for, they're creating their specific rules around PPE. Now, well, in Bexar County, we have the mask requirement. Well, in Texas, we have the mask requirement. Now the mask requirement for Texas is not required, but the city still wants us to have it, and it's very confusing. But what we've been noticing is a lot of the clients don't have access to masks, or they don't want to wear them or anything like that. So it's been really difficult to kind of balance the center policies that our LMHA provides, but at the same time, again, wanting to ensure that our staff is protected if they don't feel comfortable or, something like that. So, we've been trying to kind of make sure that we direct the clients to where they can find a mask or try and supply them with some, because again, since there is a PPE shortage, we're not just being like, oh, hey, we have a ton over here, let's just give it to you guys. So that's been difficult.
Yeah, no, I mean, it's touching on a really critical issue that I think we're dealing with in lots of ways, not just through AOT programs, but, as medical professionals, there is this need to have, fully certified N95 kind of masks that are going to prevent you from contracting as well as transmitting the virus before you go out and deal with patients. I mean, that's just, I think, an essential thing to keep staff safe. But when you're talking about the kind of things you want your clients to be doing as far as their own everyday practices, there's really no reason why anybody can't put a bandana around their face in terms of just the practicality of getting access to that, which would, may not keep them from getting COVID-19, but at least have some impact in how much they're going to be transmitting it to others. So you know, that is kind of another thing I wonder about. And a few people have talked about this already. What kind of challenges are you facing in terms of getting information to participants and having it sink in with them and having them put these things into practice, just about the general kinds of things we're all supposed to be doing in terms of social distancing and covering our faces when we're in public? A few people mentioned that, you know, their clients are very often people who tend to not socially interact anyway, that they tend to be at home and want to stay at home. So maybe it's not so much an issue there. But I'm curious if anyone has had frustrations with clients who were just not understanding the need to stay home, stay away from others, and when you are with others, to cover your face.
I can respond to that.
Okay.
Steph, we just keep repeating it and giving them flyers and handouts of hand washing. And when we do go to court or have appointments, we have masks that we're going to provide next week to our clients. But when we go to their house to do a psych appointment or go to the grocery store, we ask them to put a mask on and we provide them one.
Okay.
But we just repeat ourselves.
Yeah. Hey.
Over and over.
Yeah, that's about all you can do. Judge Kazin, I'm curious whether this is something that you have been impressing upon people in the interactions you have with them as a judge, kind of maybe trying to use that black robe effect to impress the importance of that message. Have we still got Oscar?
I don't know if we lost him on the
No.
beach or not.
Oh,
We're
there
playing the
You got me. I've just got big fat thumbs.
Yeah. So
All right.
did you hear the question?
Yeah, you're talking about PPE and impressing upon them.
We're asking about whether you have been using the time that you know, during the staffings where you're kind of communicating with people.
You know, to be absolutely
What they
honest,
should be doing, whether you've been talking about the need to, you know, use practices that keep people safe from the virus.
you know, to be honest with you, you raise a good point, because I personally have been negligent in that. We talk about them. We talk about staying healthy. You know, while they're there, they're, you know, especially if they do come, they're provided masks. You know, to be honest with you, I'm glad you brought up that subject, because it's something I have to certainly change. I should make every single staffing and every single opportunity an opportunity for me to spend a considerable amount of time telling them personally that, or my judges telling them that. I do think, however, Nicole and the center stress that upon them anyway. But I probably should take a little bit more time during staffing. If there is another judge listening to this, I would hope they also take the same lesson I am. And that is, you know, why not? Why not spend a little time drilling that as well into them?
Yeah, no, that makes sense to me too. And I would encourage anybody, you know, who works in programs where you do judicial check-ins periodically during the period of the order, that's probably a message you should try and get to your own judges. That bad idea to throw a little of that in.
And Brian, while I'm here, I just want to echo back to a previous discussion. I didn't want to interrupt.
Yeah.
You know, I can talk forever, and don't laugh too hard at that. But one of the experiences we're having here is, you said the quality of care from the center, whether it's diminished, whether the providers have a diminished quality of care because of COVID. And I meant to echo, no, but we're getting a lot of push through from the hospitals. It's almost as though when they go into crisis and they deteriorate, we send them in to stabilize to bring them back out. At least many of the facilities we deal with, it's anecdotally, it's been my experience, they're just in a rush to get them through and back out. We don't get them after their treatment in as good a shape as we did before COVID, if that makes sense.
Yeah, it does, totally. Yeah, it's consistent.
And there's also the referrals for us. The quality of the referrals have diminished. We're getting, and I can see Nicole shaking her head, we're getting quite a few of the we don't want to have to mess with this guy. We know that it's probably meth-oriented or drug-oriented and some personality disorder, but we've got too much time on our hands to handle with. Ship them off, get them out early from the commitment, and get them into AOT now. And of course, we want to help, but the quality of the referral has really, we've noticed a big difference there.
Wow.
Hey, Betsy, do you want to mention what you had written in the chat box?
Oh, well, there was a comment that some programs were having difficulty accessing masks, and I was just thinking this might be a nice, we have a few people on with us today who represent their local NAMI. I was just thinking some AOT programs have not established relationships with their local NAMI, and this might be an opportunity for them to reach out and say, hey, we really need some masks for our participants, and then give them, opportunity to, to explain the AOT program to the local NAMI and ask if they might have some volunteers who might assist in developing those. And I think that might be a nice way that might lead into a long-standing relationship.
Yeah, that's a great idea.
I know Mary Kay and Leslie, two NAMI executive directors from here in Ohio. I don't know if you have thoughts about that or other ideas about how NAMIs can be helpful during this time.
Also, is Mary Kay, are you gonna?
Oh, I was just gonna say, we're trying our best here at our local NAMI office. We've actually seen an uptick in people with severe paranoia, and they've been contacting our office, and we're doing our best to connect them to our local agencies, of course, and some could very much be helped through AOT. So we're just continuing to refer people during this time. So grateful for everyone that are helping in this process.
Also, Brian, Beta Yeager is on, and
hi. So we've actually been conducting our hearings telephonically, since a lot of the participants don't have video capability at the homes that they're in. So that's one of the first things that I review with them, is what they're doing to stay safe. And then I have them list to me all the things they're doing to stay safe, staying inside or washing their hands. And then I praise them for that and ask them to continue to do that.
Thank you. Judge Yeager oversees the AOT court in Clark County, Nevada, in Las Vegas. So we appreciate your input. Thank you. Another person I wanted to hear from on this question of how we're, our clients stay safe from the illness and protecting staff. Nick Schrantz from Butler County, probate monitor there. Nick, you mentioned in one of your emails to us about how you're seeing clients from a distance when you have to visit them in person. Could you talk a little about that, how that's going?
So I have cut back on the number of visits I make, partly because our group homes are closed, and I mentioned that in one of the chat issues. But for those people who are still either not in group homes, or there are a couple group homes I can go to, I still see a real value in doing home visits. So I'll stand on the sidewalk. The respondent will often be on the porch. We'll be on opposite ends of a porch. I try to choose sunny days when I do these home visits. I had an example yesterday where I went to a group home with one of the case managers. The respondent and her mother were there. And because we were face-to-face, we had this aha moment for the respondent, and we had just a real breakthrough in the discussion of treatment and court orders and other issues. And I don't think that would have happened by phone. It couldn't have happened by phone or even by Zoom. The flow worked much better. So I am trying to do as many home visits as I can. Most of them have been pretty successful. But yesterday's was a great example of the power of a home visit compared to phone or Zoom.
Huh. Well, I'm curious about whether the fact that you're having a conversation with someone, you're on the curb and they're on the porch of the house they live in. You're obviously having a pretty loud conversation that the neighbors can be a part of if they happen to be outside. Does the fact that it's not as confidential a setting impact what exactly people are saying? And I can't imagine you're having the same conversation you would have privately with somebody in a room.
Yeah, I haven't felt that be an issue for either myself or the respondents haven't said anything to me. I think we're generally 6 to 8 feet apart. I think that we're maintaining privacy. Certainly, if people are walking by, we stop the conversation. That type of thing. I have not felt that to be as much of an issue.
Yeah.
So
good to hear.
but I do have a real concern looking at, some of the safety issues you talk about, and I'm sure other counties have group homes where I think that's going to be the biggest concern I have is right now, none of our group homes have a reported case of coronavirus, but if they do, we're all in trouble because they're
Everyone
generally
there's gonna get
3
it.
and 4 to a room,
Right.
social distancing in a house not made for 26 people is very difficult. So
Yeah, no, that's scary stuff. That's absolutely true. I mean, given what's happening in nursing homes, it just seems like inevitable that we're going to start hearing horrible stories about group homes as well.
that's my biggest fear at this point. The group homes that we have are just doing an outstanding job of managing people, keeping them on property, trying to add some activities as best they can, shopping for them, bringing some snacks and stuff. But I'm amazed at how well they are handling it. I've been calling the different group homes to talk to the different respondents that I have who live in those group homes. They're all managing okay, but it's getting harder and harder for them as time progresses.
Yeah, no particular end in sight. Scary stuff.
Yes.
Is anybody aware of clients under AOT who have actually gotten sick with COVID-19 or anything that's happened to staff working with AOT clients?
Tarrant County, we did.
Yeah.
We've had a couple. We had one that it was kind of a difficult case because he more than likely, he worked at a grocery store.
Yeah.
And he was trying to get caught up on mortgage, all of those things after being in the hospital for a while. So he continued to press on going to work. And when he got sick, we tried to convince him to go to the hospital, which he didn't really want to do because his comment was, they're just going to tell me I have it and they're going to send me home and then I'm going to get another hospital bill. So it's been a fine line with, figuring out what we can do to get them to get checked out, but yet balancing their client rights of, ultimately it's their choice. So, but we've had a couple folks that have, so.
It's hard to hear it. All right. Does anybody else have any comments or things they wanted to share or issues we haven't touched on?
I know this is Eric.
Hey, Eric.
Hey, I know y'all are very, very busy. I just wanted to quickly talk about how COVID-19 is affecting people's ability to get lab work done. And I'm speaking from a personal experience that just happened a couple of weeks ago. So I use a major lab in Texas. It's called CPL. And I went in during the normal time like I normally do. It's right around the noon hour before they go to lunch. And they had a sign on their door that said, due to COVID-19, all of our locations are now closing down at noon from this point forward. So had I shown up there 4 minutes later, I literally would not have probably had my meds on time that day. So I think that it should be at least on the list of things to do for people in AOT programs to make sure that if they're using labs that are external to, let's say they're like Judge Kazin, he actually had a nurse on site that would do it. But for any place that is using external labs, we need to be aware of that because we don't want an interruption medication because of, let's say, hours that are being reduced by labs.
Yeah.
This is Milton Mack from Michigan. And I got in late because my Zoom invite didn't show up on time, but that's okay.
Oh.
We have a bit of an advantage in Michigan in that about half of our mental health trials were conducted through Polycom at the time COVID hit. But we had also bought all these Zoom licenses, so now all of our mental health hearings are being conducted via Zoom, as well as everything else, frankly. The only thing we're not doing by Zoom is jury trials because we haven't figured that out yet. But and we have our employees, like I'm at the Hall of Justice, State Court Administrative Office, nearly everyone's working from home. And so our operating assumption going forward is that you should be working from home unless there's a reason you should come to the office. And likewise, if it's a court case, it should be handled via Zoom unless there's a good reason for people to assemble at the courthouse. There's a writer, Richard Susskind, you may have heard of him, And he's talked about the future of the courts, and this is one aspect of it. But I thought I'd also mention, this is not really COVID related, but the way we have altered AOT in Michigan, and we've created a very streamlined process. So that the Community Mental Health Agency, if they feel someone needs to be on an AOT, the psychiatrist signs a petition and files it with the probate court. The court appoints an attorney who visits with the individual to advise them of the hearing and the rights and so forth, and then they have a hearing. There are no certs. The individual is not arrested. I know it's not an arrest, but it feels that way if you're the person. Not arrested, not hauled to the hospital, not kept against their will. And they have a hearing, and at the hearing, the judge decides whether or not to order AOT. If so, it goes back to the psychiatrist who fills out the rest of the order, what medication, what counseling, and so forth. It goes back to the judge, and then that becomes the order. So the Huron County is doing it that way. And of the first 10 cases, the individuals had a history of nearly 40 hospitalizations in the previous 5 years. Since they've been on these orders, 9 have had no hospitalizations. One has had 2, and he had had over 10 before. So they're saving an enormous amount of money on hospitalization. At the same time, these individuals are staying well, staying out of trouble, and being compliant, because the penalty for non-compliance is 10 days in the hospital. And an individual doesn't want to be in the hospital any more than they want to be in jail. So I thought I'd just pass that on, because it's a good, smooth system that's more efficient, doesn't waste a lot of resources.
Yeah, no, that's phenomenal to hear. And have those results in Huron County continued unabated through the current crisis, or?
So far. They're a little harried right now, but
yeah, well, encourage them to join our network here. We'd love to get to know those folks. That's really exciting. Thanks for sharing that, Judge. Anybody else feel something has gone unaddressed that's important on this topic?
Jean Harris mentions that parents who have adult children at home are scared because if one of their children goes out and without protection comes in and out, and they're concerned about getting COVID that way. Is Jean, I can't find you on that. So if you can unmute yourself, you'd like to share more about that? Jean Harris?
Yes, I'm here.
Oh, there you are.
So I've just had several different families in this kind of circumstance where their loved one is not in treatment, where they do not consider this quarantine to be important at all. And of course, they can't keep them in the house locked up. So they're going out in the world doing whatever they please without any mask, without any gloves or anything, bringing whatever back in the house. And so I'm dealing with family members that are having their own mental health issues regarding this constant fear that their ill loved one is going to make them sick. And if they were to get a severe case of COVID, then if they were to pass, then there wouldn't be anyone to take care of their child who is ill.
Yeah. Boy, it's tough. I wish there was an easy, neat way to respond to something like that. But
You know, Brian, I don't know about the other judges that are on, but I'm getting quite a few requests for detentions and intervention from parents who are saying, you know, my loved one's mentally ill, they're not complying with treatment. We feel they're a danger to themselves or others because they're out on the street with COVID. And it's been quite a challenge to try to, you know, explain to the parents that as much as we care and want to help, that by itself for most jurisdictions isn't enough to bring them into AOT or treatment. But there is a huge increase in parents who are just so afraid that their loved ones are either going to become infected or bring home an infection. It's just something that we all have to deal with and explaining, I think, very gently and at the same time not dashing any hope of a future AOT.
Yeah, Yeah, it's an interesting question. You know, I actually think on the inpatient commitment side of things, where you're dealing with a person's current condition rather than their history to make them eligible for the commitment, I think there's actually a pretty strong argument that could be made that that is a form of being dangerous to yourself or others. If your mental illness is preventing you from taking the basic actions we all need to be taking right now to protect ourselves from this virus, you know, I don't think that's an insignificant approach to trying to get somebody hospitalized.
Yeah, I've struggled with that as well, but I know that if I ordered what we call a mental health warrant or an OPC based on that action, the hospitals aren't going to keep them on that alone.
Yeah.
I mean, they would probably then have to commit everybody at our Haven for Hope, which is, you know, 1,000 homeless people under one shelter over there.
Yeah, no, understood. Obviously, there's a big difference between something that theoretically meets the criteria of the statute and what practically.
Yeah. It's just a shame, is what it is.
Yeah, it is. It is. All right. Anyone else who wants to add something?
This worked great.
Sorry, what's that, Oscar?
This worked great. Wow.
Oh, I'm so glad.